Hi, my name is Julie Siegenthaler, and I'm a program manager with the Fire Safe Council of Nevada County. I have a quick presentation that I'd like to go through with you to discuss the COVID-19 measures when you're conducting a defensible space advisory visit. Let's get started. We have some training objectives. The first one is learning whether we should conduct a visit. The second one is learning about using personal protective equipment. The third objective is learning about keeping our hands clean. The fourth one is learning how to safely communicate with the resident. The fifth objective is reminders for discussing the DSAV packet contents. And finally, asking for suggested donations. And thank you so much for taking the time for this training. All right, the big question, should you conduct a defensible space advisory visit? The answer is no if you have or suspect that you have had COVID-19. No if you know that you have been exposed to COVID-19 in the last 2 weeks. No if you have any symptoms that are resembling COVID-19. No if you have other health conditions such as respiratory vulnerability or other serious health conditions. No if any of the above conditions are true about the person who is requesting a visit. Safety is definitely a two-way street. We don't want to expose our advisors any more than we want to expose residents to COVID-19. However, if you are healthy and you know that you've not been exposed, by all means conduct that visit. And yes, if you have verified with the resident that they are well as well. Personal protective equipment includes things like gloves and face coverings or masks. Please use a face covering during your visit. Feel comfortable asking the resident in advance of the visit to use one as well if you prefer. It's a best practice right now. If you'd like to use gloves, please do so, but don't put them on until you've exited your vehicle, because if you put them on while you're in the vehicle and then you start touching surfaces that may have the contamination on them, you could easily spread them. Gloves often provide a false sense of security, and so we want to make sure that we are aware of that and we're putting the gloves on at the last minute. When you're done with your visit, dispose of your face covering and your gloves prior to re-entering your vehicle. And that's just to protect your vehicle and your surroundings from contamination. It's a good idea to bring a plastic bag or something like that you can put those items in, seal it up, and then you can bring them home and dispose of them. The CDC recommends at least a cloth covering over your mouth and nose, but advises that they are not as effective as a medical grade mask. Please maintain a 6-foot minimum distance, even if you're wearing a face covering. Refrain from touching your eyes, your nose, your face covering, or your mouth during your visit. All right, keeping our hands clean. As we wash our hands, you want to wet them and apply the soap, rub them together to create a lather. Make sure you lather the backs of your hands between your fingers and underneath your nails. Scrub your hands for at least 20 seconds, and if you need a timer, you can hum the happy birthday song from the beginning to the end twice. Rinse your hands well under running water. Dry your hands using a clean towel or air dry them. If soap and water are not available, use an alcohol-based sanitizer with at least 60% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Avoid touching your eyes, nose, and your mouth with unwashed hands at all times, before the visit, during the visit, after the visit. And just like they tell us in kindergarten, keep your hands to yourself. Every surface that you touch could well be contaminated. Therefore, wash your hands well before and after your defensible space advisory visit. Communicating safely. You want to make sure that you are communicating safely with the resident of the home during your visit. Therefore, don't shake hands with the resident. Don't enter the home. Please remain outside. Maintain at least a 6-foot distance from the resident. And as you speak, try not to face them directly. If you do have to cough or sneeze, turn your face into your elbow. A cloth mask or a face covering does not fully eliminate droplets. Bring a travel pack of tissues or put a clean tissue in your pocket so it's readily available. Throw used tissues in the trash can immediately. If you feel uncomfortable or unsafe at any time during the visit, you can ask the resident if you can reschedule. If you prefer, you can conduct your defensible space advisory visit with the resident remaining inside the home. At some point you'll have to communicate, but you can do that by phone or by email. You can still walk the perimeter of the home and make notes and complete the packet and leave the completed form with them on their porch or under their doormat, and then circle back around to have the conversation that you need to have. This is, of course, just in case they prefer to remain inside the house. That may be the case. Perhaps you arrive and then the last minute they decide that they're uncomfortable being outside of the home. That's okay. As long as you have permission to be on their property, you're going to be all right. You can fill out the Defensible Space Advisory packet. You're going to need some time to go over an action plan with them, so plan to do that over the phone. Okay, inside the DSAV packet, there'll be a lot of materials. You can see the little image of the cover there on the screen. Take some time to discuss the materials inside the packet, whether by phone or in person. There's going to be a chipping service form. There are going to be forms on reflective signs. There's going to be a form about membership. There'll be the action plan that needs to be completed. There's some information about signing up for Code Red, which is really important. And just so you know, the annual free residential green waste collection event begins May 17th, just a few days from now in 2020. We'll be at 3 different locations. The first one will be at the Penn Valley Rodeo in Penn Valley. The second one will be at the NID site in the Alta Sierra community, and the third will be at the old Idaho, Maryland, currently Rise Grass Valley site over at Brunswick and Bennett. And the collection will take place Sunday, Monday, and Tuesday of each week for 6 consecutive weeks. So we'll be finishing up everything by June 27th. Also, chipped material will be available at the Penn Valley site and the Grass Valley site every Friday and Saturday through the end of the event. We ask that residents do not put that within 30 feet of their home, but certainly it can help at other places on their property. So all of these conversations that you have with the residents really helps them to understand the mission of the Fire Safe Council, and you're about to see why that's important. The suggested donation. So all of the services that we provide are made possible by the support of the community and through grant funding. This is a great time to let that resident know that the suggested donation for a Defensible Space Advisory visit is $25. They can pay for that using the envelope that's included in the Defensible Space Advisory packet, or they can visit the Fire Safe Council website, which is www.rufiresafe.com. This is also a great time to suggest to the resident that they encourage their neighbors to conduct Defensible Space Advisory visits and further improve the safety of the community. So, thank you for listening to this quick training. I hope it was informative. If you have any questions, feel free to call the Fire Safe Council office. Though we are currently closed to the public, we are still accepting phone calls and can answer questions that you may have. Our phone number is 272-1122, and you can also email me at any time. My email address is programs@rufiresafe.com. Thank you very much. Have a good day.